Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things that you should be aware of before using Buspirone or Buspar. Number 1, when you start using Buspirone, you may experience neurologic side effects. In terms of percentages, about 12% of patients may experience dizziness, 6% may experience headaches, and somnolence seems to occur about 10% of the time. Somnolence is a state of drowsiness or a strong desire to fall asleep. Now, because of these side effects, namely somnolence, it's a good idea to avoid things like driving an automobile just after taking a dose until you've used Buspirone long enough to know how the medication makes you feel. If you are in the 10% of patients that experience somnolence, there's a good chance that this side effect may subside after some time of using Buspirone, but if it does persist, there is the option to talk to your physician about using a different medication. Number 2, although you may have been prescribed Buspirone for anxiety, some patients experience nervousness after starting it. Buspirone is generally a very well-tolerated medication in terms of side effects. However, 5% of patients who use Buspirone do experience a heightened feeling of nervousness. This side effect can be troublesome when the medication is prescribed to treat anxiety because it may give the patient the feeling that it's making the anxiety worse. It's best to use Buspirone for several weeks before you make the decision on whether or not it's the right medication for you, because over time, the feeling of nervousness may subside and the anxiety improve. Anxiety may also get worse for patients using Buspirone if they miss a dose or stop using the medication abruptly. Now, before I tell you the third thing you should be aware of, I want to quickly take 5 seconds to let you know you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. And number 3, how is Buspirone dosed for anxiety? Initially, patients would typically start off with a dose of 7.5 milligrams taken twice daily. They would then increase the dose by 5 milligrams per day every 2 to 3 days as needed. The usual maintenance dose is 20 or 30 milligrams per day given in divided doses, so 2 doses of 10 milligrams or 2 doses of 15 milligrams. And the maximum dose, if a patient gets up to this point, is 60 milligrams per day. Buspirone is dosed differently and the max dose is higher when patients are using this medication for the off-label indication of treating depression. And that's it for 3 things to know before using Buspirone. Take care.